Hello everybody. I hope all of you are doing fine. And the topic of discussion right now is Ukraine, Russia, NATO. But I'm not here to discuss about that. There are plenty of discussions already going on. But I'm here to address some concerns about that parents have and some concerns that students also have as to why should we be going abroad and why should we not be going abroad. So welcome to my channel Evolve #21. If you like my content, please do keep subscribing to my channel and keep sharing it. So today we are going to talk about the advantages and disadvantages of studying medicine in India and abroad. Okay, so and approximately 750,000 students went out of the country in 2018, and this figure jumped to a whopping 16.8 lakhs in 2020. These are the number of students who do not get through NET, that is your medical examination test, and they don't want to lose out on a year. They are very eager to study medicine, and so the next best option is going abroad. So the best universities are there in USA, UK, Europe, New Zealand, Australia, Singapore. Studying there is very, very expensive, but there are certain countries which do offer MBBS course in a budget, and those would include China, Russia, Philippines, Kazakhstan, Ukraine, Georgia, Poland, Armenia, Nepal, to name just a few. So these are the target countries where our students are flocking. Now let us look at the advantages and the disadvantages of studying abroad. What are the advantages? So you get to study in the top universities of the world. Now, so you get kind of, your medical degree has a global recognition, and you get the best state-of-the-art facility. You also get advanced technology to study in. So that is something that attracts our students a lot. This is one thing जो हमारे students को बहुत attract करते हैं. The next point is these universities, they offer scholarships and financial aids. So because ये scholarships देते हैं, financial aids देते हैं, तो it is easier for these students जो NEET नहीं qualify करते हैं, उन लोगों के लिए कि वो बाहर जाके भी MBBS pursue कर सकते हैं. थोड़ा scholarship लेके थोड़ा पैसों का भी discount हो जाता है. Now NET offers only 80,000 seats in India, whereas these colleges outside the country, they offer plenty of seats for everybody, and that is very, very you don't get rejected. So that fear of rejection, वो जो डर रहता है कि मैं नहीं पढ़ पाऊंगी या फिर नहीं पढ़ पाऊंगा, वो नहीं रहता है. So that is very, very that attracts the students a lot. Next point is these colleges are budget friendly. I'm talking about Russia, China, Nepal, Kazakhstan, Ukraine. So these are the amount of fees that one has to pay in these colleges are equivalent to, and these are top universities. So the amount of fees that you pay outside is equivalent to B and C category medical colleges that you spend in India. So it would roughly, for a period of 5 to 6 years, it would vary between 35 to 50 lakhs. And that is much, much cheaper. There is no capitation fee of some 50 lakhs, 75 lakhs, 1 crore included, which some of the private colleges, top private colleges in India ask for. So it is much cheaper for them to study abroad. And of course, there is this extreme eagerness amongst the students to go abroad and study. Moreover, the modus of study is a little different in universities outside. They do case-based studies. So understanding medicine probably becomes, I am no doctor, so understanding medicine becomes probably a little easier for these students as they do case-based studies for most of these universities. And universities across the world, they mostly use English as their preferred language, and that becomes very easy. Whereas in some of the colleges in India, if they are the government colleges and they are in sometimes these people, they revert to the regional language, and that might not go down very well with somebody who is coming from a different part of India, because India, as we know, is a very vast country, and so it becomes easier for them to understand what they are studying. Another important thing is most of our study pattern is subjective, but in universities outside they have multiple choice questions which are easier for these students. So these are some of the advantages that students find who have not been able to clear that NEET examination for going abroad, and that is why these people are flocking outside. Another important thing that we get to understand is once you study in these foreign universities, you also have the license to go and practice there. So if you are one of those students, or if you are one of those parents who would want your children to settle outside the country, then do send your children outside, because with that, practicing medicine, a very noble profession, still the most noble profession, they get to settle abroad. Now coming back to the disadvantages of studying abroad, studying your medicine abroad. The first one is clearing the MCI test, that is the entrance test that you have to clear once you want to practice in India. Now, because it is a little difficult, a lot of students do not pass this test and find it very difficult to pass this test. So these are not for students who want to stay back in their country, in the other country, but these are for students who are coming back to India and they want to settle and practice medicine in India. You have to clear the MCI, so that becomes a little bit difficult, but of course you can study and make up for it. Language barrier, though the medium that is practiced is English, but when you are in a different country and you are staying there for 5 to 6 years, and if you don't understand the local language, settling there becomes a little difficult for you, because you have to do your daily activity, you have to get your food, you have to get your dresses, you have to get other things. So knowing the local language is always an advantage, which is always not possible, especially if you're in China or Russia or Kazakhstan or Nepal. So language barrier is another problem. So there are some examinations that you need to clear before you can directly get into these colleges. So in North America it is MCAT, for Australia it is GAM SAT, for studying biomedical you have to clear BCAT, UK CAT is for studying in UK, and IAMAT is to study in any of the international colleges. So these are some of the cons that some people find intimidating. So medicine is a subject that is learned hands-on, right? So when you are learning something hands-on, it is and you have to understand the patient and the background, medical history of the patient and the background. So the food, the culture, the patient culture, food habit becomes very important for you. So if you're one of those students who's planning to come back to India, you will face a complete difference, because the food and culture habit of patients that you have seen in the colleges that you have studied are going to be very different from what it is in India, because diseases differ in tropical countries and in countries abroad. So you have to be a little careful about that, and some doctors face a challenge dealing with this. Next is the climatic adaptation. You are from India, whatever part you are from India. So when you go to one of these countries outside, your body has to adapt itself to these climatic conditions, and adapting to these climatic conditions are sometimes it takes a toll on your body. The food, the climate. Suppose you're going to Russia, it's extremely cold there. Most of the European countries, most of the North American countries are extremely cold, extreme cold climate. So adapting to that extreme cold takes a toll on your body. Then the food is also very different. So adapting to that also takes a toll on the body sometimes, and many students have to come back. Now these universities so if you are in Russia and somebody or your friend is in Kazakhstan, and another friend of yours is in North America, another person is in Australia, so all of you are in the best of universities imparting medical knowledge, but all of them have varying standards. So there is no standardization that is followed. So that becomes a problem for students, especially when they come back and take the MCI examination here, because of the varying standards of different universities. I am not here to condemn any universities, all of them are wonderful, but some universities focus on certain things depending on their geographical conditions, and some universities focus on others. So these were my list of the advantages and the disadvantages of studying medical abroad. Now, because so many of our students are in Ukraine right now wanting to come back to India, and so we were kind of unaware, a lot of us were unaware that such a huge amount of Indian students actually go out. So here was a small attempt by me to kind of tell you why these people go abroad, and also for those who are planning to go, so better look at the advantages and the disadvantages of studying abroad, and have a thorough checkup on the universities, on the living conditions and everything that is there before you take a leap, so that you are not stuck like many of our students in Ukraine right now. Let us pray for them, and you do take care of yourself. Thank you very much. Bye-bye.